Naima Sedegah, and I'm the senior psychologist here at Alexander Youth Network. Been with the agency, has been a few months, but I've been working as a mental health clinician for over 20 years. You're thinking about online therapy, you should make sure, this is important, that you have the tools to engage in therapy online. And what I mean by tools is one of the essentials thing is you need the internet, right? So connecting through a secure network, something that's gonna keep a stable, quote unquote, lifeline for you and your therapist to connect, so there won't be a lot of interruptions in between you trying to connect. Also having a reliable place and a nice secure place for you and your child, or your child to meet in a room where there's not a lot of distractions, where the child feels safe and they can hear, and that they're open enough to share and engage with the therapist. Another thing that you might want to look forward to, and with technology, is making sure that the therapist has the schedule to accommodate your particular needs. So in an instance where there may be some therapists where they have limited availability and they can only meet during regular business hours, which wouldn't really be accessible for a parent who's got a child that's in school, a traditional school, and they're doing a traditional school day and they're out at 3, and that doesn't really leave a lot of time for therapy after school is out. So thinking about the therapist and what their hours of operation are, there's a lot of therapists out here who offer evening hour services and weekend availability, so that might be something that you think that might be helpful for your family and your personal schedule. Another thing I think would be really helpful for parents to think about when choosing a therapist is also their specialty area. And again, this goes back to your individual needs. So if you have a child who's, for instance, suffering from some grief and loss, it would be helpful to get some specialist who knows how to treat individuals who've gone through some loss, how to deal with grief, and also who've worked with children with those type of issues. So a therapist may have the skills to treat grief and loss, but have they had the skills and experience to treat a child who's gone through the issues with grief and loss? So treatment needs should be tailored, and it should be with someone who has some experience, working with children with those special needs. And I think those things are essential. So we're talking about your options. You've got options. You can go online, you can look at some therapy videos online, and you can even start, even before therapy, you can even have, you and your child sit back and watch some videos about what it would be like to be in therapy, and having a conversation about what that could be like for you and your family. And then have a discussion with your family and your child about, would this be something that you think might be helpful? What do you think you might want to say, or things that you might want to talk about? And I think those things are essential for meeting with the therapist, because you've collected some data from you and your family and your child about what it is that you want the therapist to help you with. So you're coming in with some information for the therapist so that he or she can better help you, if that makes sense. So in a sense of like what you should be looking for in a therapist, really starts with what you want and what you need, and then come into the therapist with some of the things that you think will be helpful. And I find it really exciting and brave and pretty thoughtful for families and kids to come in with a list of stuff, like a laundry list of what they want to do, like a to-do list. And that way, you've given yourself some time to think about what's important to you, and also being intentional about what services you think would benefit your child or benefit the family.